Welcome to SynergenX, where we want you to feel great and look great. Our goal today is for you to have a great experience. This video will walk you through your visit with us today. At SynergenX, we do more than just evaluate your testosterone levels. We look at the entire hormone picture. Today we'll be evaluating your symptoms and your blood work to see if you're a candidate for treatment. We'll go over your total testosterone and prostate levels. These results are done right here in our facility and we'll be ready in about 30 minutes. Why are your testosterone levels so important? Well, they determine to what extent, if any, that you can experience greater energy, strength, sex drive, and mental focus. Our knowledge of your levels can mitigate the risk of negative side effects related to therapy. If your testosterone is low and needs replacement, we'll recommend starting treatment from SynergenX or with your primary care physician. What exactly is therapy? Well, we replace testosterone through injections. We recommend doing the injections every 7 days because this allows us to keep your testosterone level in a range that creates the least amount of risk. The more frequent interval of the injection allows for a more consistent level of hormone to remain in your body at all times, giving you a more stable range of testosterone to maximize your benefits. What should you expect from your visits here? Your first appointment is probably going to be the longest time spent at our center. It usually takes about 45 to 60 minutes. At this appointment, we'll draw your blood, answer any questions you have about therapy, and you'll meet the providers who will be caring for you. Your second visit will be much shorter, probably only about 10 to 15 minutes. It will involve a lab discussion and an injection appointment. This is how your subsequent visits will also go. Plus, you'll have the opportunity to discuss any problems or possible side effects at each visit. Your experiences while being a patient at SynergenX Health Center are generally very short and productive. This is why we're flexible if you need to change your appointment times and dates even at the last minute. We're very sensitive to your time and want to ensure that you can get in and out of the center in a timely manner. We don't want you to ever feel rushed or hurried, but we also want to be respectful of your time. Let's talk about what you can expect to experience with your therapy. First off, it's neither a marathon nor a sprint. With the first or even your second injection, you may not notice a great deal of change. On the third injection, however, you may experience a subtle increase in energy. When you come in for your sixth injection, we'll retest your blood work so we can identify how you're responding to therapy. Once we determine your body's response to the medication, we can adapt your dose to maximize your therapy's benefits. Let's talk about these benefits. They can vary from patient to patient. Some patients experience a benefit early in therapy, and others may take 90 days or more to begin to appreciate the changes. Generally, you should expect improved energy and motivation throughout the day, especially as the day wears on. Many of our patients report the feeling of an overall better mood and generally feeling happier. They also note that they sleep deeper and feel more rested. You should also experience an increased exercise tolerance, as well as an improved motivation, initiative, and sex drive. What separates SynergenX from other testosterone centers? First off, we do variable testosterone dosing, tailoring the therapy to your blood levels and symptoms. Most primary care providers will place you on a standard dose that may not raise your levels high enough to feel a change in symptoms. Second, we perform frequent lab testing and monitor lab values often to ensure that you're safe and in optimal ranges. We'll retest your testosterone, estrogen, PSA, and CBC at least every 3 to 6 months from the beginning of therapy. So what are the possible side effects of testosterone replacement therapy? Testosterone can decrease a man's fertility level. If you're considering having children in the near future, we recommend holding off on treatment or to pursue other options as well, such as fertility counseling or freezing your sperm. In some cases, we can prescribe HCG as a backup potential fertility aid. While testosterone therapy can make you feel young again, it can also make parts of you look young. Believe it or not, it can cause a potential resurgence of acne as testosterone and estrogen play a role in the production of the oils in the skin. It's typically not a common problem, but it can happen. If it does, we treat it with simple body washes or oral medications. Fluid retention and mild weight gain is common in the first 90 days. Testosterone causes our body to retain a little extra fluid in the cells, which can equate to a small weight increase early on. An average weight gain may be 6 to 8 pounds. Today, you'll also get a body composition analysis, so we can monitor your water weight versus your muscle gain from testosterone treatment. Another side effect of testosterone is deeper sleep, which could cause worsening of sleep apnea in some individuals. If you have excessive snoring, wake up multiple times at night, or wake up feeling unrested, you may benefit from a sleep study. The two most common side effects of testosterone replacement therapy are elevated hematocrit levels, or blood thickness, and elevated estrogen levels. We'll monitor your hemoglobin and hematocrit, also described as blood thickness, by testing your CBC or utilizing a fingerstick HemoQ to ensure that your levels remain in safe ranges. Testosterone can cause your body to create more red blood cells. The more red blood cells you have makes your blood thicker. When your blood is very thick, over 54%, it can cause a heart attack, clot, or stroke. The blood will thicken by 3 to 5% with any method of testosterone replacement. If your blood thickness or hematocrit level gets at or above 50%, we'll ask you to donate blood either at our center or you can go to an outside source. Now, estrogen is the opposite hormone of testosterone. Its function is much like a wet blanket on the benefits of therapy. One reason we monitor estrogen levels so closely is because of gynecomastia, or breast enlargement. This can occur if your levels are elevated for long periods of time or if your body is hypersensitive to estradiol changes. If symptoms are present, we'll address it right away, either through laboratory testing, over-the-counter supplements, or prescription medication. It can also cause fatigue, low sex drive, or weak erections if elevated for an extended period, and the symptoms are ignored or not addressed. This hormone is not all bad. It also plays a role in our good cholesterol production, prevention of osteoporosis, and even a small role in sexual drive or function. At SynergenX, we pride ourselves on monitoring your estrogen levels to mitigate possible adverse side effects. We will also monitor your prostate levels very closely. Testosterone potentially can cause worsening of an enlarged prostate. Testosterone does not cause prostate cancer, but if you have a pre-existing lesion, it could cause it to grow and worsen. This potential side effect is why we check your PSA every 6 months and inquire about urinary symptoms regularly with a urinary questionnaire. Typically, we will not see changes in cholesterol levels or liver function enzymes, but there always is the potential for either value to worsen. Historically, these changes most often occur in the setting of testosterone abuse, which is not what we're about. These undesired changes also occur with the use of oral forms that are typically not used legally in the US. Now, what if you want to discontinue your testosterone therapy? If you decide to stop therapy at any point for any reason, your body will typically rebound back to the levels where you were prior to starting therapy, or possibly even a lower level. The rebound can take quite some time because with testosterone therapy, the body recognizes satisfactory levels of the hormone, decreasing your internal production of testosterone while taking the medication. This downregulation of your own production can take a few weeks, months, a year or more to return to a consistent level of production. This is why if you're getting a benefit from testosterone replacement therapy and you want to maintain that benefit, you should plan to remain on it for the long haul. Finally, understand that we do not take over the role of your primary care physician. You should maintain all your normal doctor and medical appointments. We advise you to have an annual physical and prostate exam completed by your primary physician. Thanks for watching. Now your provider will be in to discuss your lab results and perform a physical exam. Then your medical assistant will get you your injection if you're a candidate and choose to start therapy. Finally, we'll set up your next appointment. If at all possible, try to pick the same day of the week for your injections to keep your testosterone level consistent. Thank you for visiting SynergenX, where our goal is to make you feel great and look great.